Today I'm going to perform a shoulder mobility test for my subject here, Miss Kim Fang. So it can help to test the flexibility of her shoulder. Okay, Miss Kim Fang, so can we do it? Okay. First of all, can you please face towards the wall? Okay, so now I'm testing her left side shoulder flexibility. So I need you to bend your right elbow. Okay, let's try to reach behind between your shoulder blade. Okay, then try to draw downwards. Okay, then with your fingers pointing downwards. Okay, at the middle of the trunk. Okay, then I need to please try to bend your left hand. Okay, and try to reach behind with your palm facing outwards. Good. Okay, and the fingers pointing upwards. So now I need you to reach as near as possible. Try to touch them together. Yeah. Okay, so as you can see, Miss Kim Fang is overlapping the fingers. Okay, it means that she has very good flexibility of her left side of shoulder. So I will measure the right side of her shoulder as well. And if she couldn't able to reach the fingers or overlap them together, okay, so I will measure the tip of one hand to the tip of middle finger of one hand to the tip of middle finger of another hand. Okay, let's try to hold. So there is 10 cm. It's moderate. Okay. So that's all. Thank you. And I've tried to measure 3 times. Hi, now I'm going to perform my second test. Okay, it is called active spinal extension test. Okay, I will be measuring the flexibility of the rectus femoris muscle. Okay, of Miss Kim Fang again. So I'll see how much she can bend. Okay, bend the trunk upwards. Okay, so Miss Kim Fang, can we do it? Okay, so at first I need you to lie down facing on the mat. And I have a few instructions, okay? So later I need you to bend your neck and your shoulder upwards, okay? And try to wiggle for a few seconds. And you shouldn't tip your toes up, okay? Your toes shouldn't leave the ground. And okay, please look forward and make sure that your head, level of head is parallel with the ground, okay? So, okay, let's do it. So, I'll measure from the chin. Okay, please look forward, yeah? Okay, to the ground. Okay, it is 27 centimeters. Thank you. So, the normal range of active spinal extension test is 15 cm average for a normal individual. Okay, since Miss Kim Fang has achieved more than that, so she's within a normal range. Okay, so and I will also measure 3 times and get the best value out of it. So alright, thank you, Miss. That's all.
Okay, so today I'm going to perform 2 tests on my client. Okay, so first test is called sit and reach test. Okay, so basically this test is to check there's any hamstring muscle tightness. Okay, so now I'm going to position my client. Okay, so Miss Kim Fang, can you straighten your leg and touch this one? Your foot. Okay, good. Okay, and then keep your back straight. Try to raise up your arm and then keep your elbow straight. Okay, good. Okay, so now let's say this is a starting point. So I will have my client to outstretch the hand and then reach the point and mark it. Okay, can you try to stretch your hand without bending your back and without bending your knee? Okay, and then try to stretch. Can you do it? Okay, good. Now I will mark. Okay, thank you. Okay, so basically this test we have to measure for 3 times. Okay, so let's say this is the third time measuring. Okay. So the result is 10 cm. So for female, if the measurement is below 23, it's considered poor flexibility. Okay, so the next test is called Modified Thomas test. Okay, so basically this test is to check whether there's any tightness on the iliopsoas muscle, iliotibial band, and also rectus femoris. Okay, now I'm going to position my patient. Okay, so Ms. Ken Fang, can you sit outside a bit, sit on the edge of the bed? Okay, good. Then I have you to lie down on the bed. Okay. So what I'm going to do is passively lift up my client's leg until reach her limit, and then I let my client to hold the legs for herself. Can I hold here? Okay, good. Both hands. Oh, okay, good. So while my client is holding her legs, I will check whether there's any lifting out of the hip. Okay, if there's any lifting out of hip, that means she has iliopsoas tightness, which my client don't have. Okay, now I'm going to check for iliotibial band tightness. Okay, so my client hip doesn't move outward, that means she don't have the iliotibial band tightness. So now I'm going to check for any rectus femoris tightness. So my client has slightly lift up, extended her knee, so there's a slight tightness of her rectus femoris muscle. So this test we have to perform on both the legs.
Now I'm going to perform the test for testing the calf muscle flexibility. So first, I'll position my patient in standing position with the face facing the wall. So, and then I will measure the distance from the wall. It's 10 cm to the great toe. Sir, can you please come in front? Okay. I would like you to place your great toe at this point. Okay, good. So, on the other leg, on the opposite leg, we'll have the opposite leg, place one leg behind the testing leg. Okay, sir. Now I'd like you to face your face towards the wall with your hand placing on the wall. And now I'd like you to bend your kneecap. You can bend both of your legs, but you should not lift the testing heel off the ground. So you have to bend your knee as much as you can. Bring your kneecap towards the wall. Okay, so can you do that? Okay, so if the patient, relax. If the patient is able to perform at this 10 cm distance, I will increase the distance again by 1 cm. Okay, sir. Okay, good. So step on this point. Okay, same the sir. Can you please bend your kneecap towards the wall as much as you can without lifting your heel off the ground? Okay. Okay, so I can see that patient's heel is actually slightly lifted up. So for this, I will consider that his distance is at 11 cm. And we'll perform this test for 3 times. We'll also do it on opposite leg. So 10 cm. So step on this point. Okay. So the same, bring your kneecap towards the wall. Okay, good. So as you can see, he's also able to do it on the normal distance, which is 10 cm. We also further progress this distance until my client has his heel lifted off the ground. So if my client has his distance less than 9 to 10 cm, it indicates that he is having calf muscle tightness. So this is the test to test for the calf muscle flexibility.
Hi, today I'm going to do groin flexibility test in order to test hip abductor tightness. Okay, so for this, I will position patient in sitting positions, okay, with knee bend. Okay, so miss, now can you bend your knee? Okay, good. So make sure that the knee is touched together and the feet is touched together as well and flat on the ground. Okay, so now I'll ask patient to drop their knee sideways. Okay, so miss, can you drop your knee to the side? Okay, as far as they can, as far as you can. Okay, and then make sure that the sole is touched together. Okay. Then I'll ask patient to use their both hands to grab over their feet. Okay, grab it. Okay. Now, miss, can you move your feet towards to your body as near as you can? So, the measurement is taken from the heels to the ground. Okay.